Hi, my name is Dr. Law. I'm a craniofacial surgeon in Dallas, Texas. I want to talk with you today about some of the anatomic considerations for repairing a primary unilateral cleft lip. Today I want to talk about the white roll and the red line. So the white roll is that border between the skin of the lip and then the dry vermilion, this part right below it. And right between it, between these two are the white roll and then this roll, this depth, I call it this concavity above the white roll where it rolls into the upper part of the lip. The red line is that border between the dry vermilion and then the wet vermilion, the mucosa, the part that really likes to be wet and inside the mouth. That's another key anatomic landmark for a satisfying repair in terms of balance, but also function. Because sometimes I see older patients who have had that mucosa end up on the outside of the lip, and it ends up dry and it cracks and it bleeds, and it's something that's avoidable if we keep that in mind for the first repair. So this white roll, again, is the junction between the skin and the vermilion, and you can see here that if this is lined up, it can avoid any unwanted attention. And then you can also see that the dry vermilion here, there is a little bit of excess bulk right along the margin, but for now, this vermilion is all dry on the outside, wet on the inside of the lip, and then as he grows, that bulk may be revised if needed. Sometimes it does shrink down with time as he gets older, and the scar tissue continues to soften up. But again, the three-dimensionality of this white roll is very important with the peak, the valley below it, and then in separate videos we talk about the remainder of the lip, the cutaneous part of the lip. But this border and the vermilion are very important for a satisfying repair that is both aesthetic and functional. Thanks, and come back for more videos.